Today I will be presenting my poster titled Interventions for People at Ultra-High Risk for Psychosis, a systematic review of economic evaluations. So to begin, I'd like to briefly describe psychotic disorders. They are mental illnesses that have a negative impact on the quality of life and functioning of an individual, as well as a lasting impact on their family and society. As a result, early psychosis intervention programs exist to intervene early in the course of the illness. This includes programs to treat people experiencing their first episode of psychosis, as well as people who are at ultra-high risk for psychosis. While previous reviews have suggested first episode psychosis programs are cost-effective compared to the standard of care, ultra-high risk program cost-effectiveness has been less established. The reviews that do exist on this topic have either excluded cost analyses entirely or are older reviews. As a result, we decided to conduct a systematic review of economic evaluation studies examining the cost and cost effectiveness of interventions for people at ultra-high risk. So this leads us into our methods. So we looked at the Cochrane, OnBase, Medline, PsycInfo, and Gray literature sources from inception until March 2020 for any cost and cost effectiveness studies on the ultra-high risk population. We excluded clinical effectiveness studies, reviews, abstracts, and any non-peer reviewed work. We also had one person complete the title and abstract screening, two reviewers complete the full text, with a third reviewer available for any disagreements that occurred. We also completed a risk of bias assessment. So for our results, in total, we found 1,916 articles, with 6 meeting our inclusion criteria. 3 were cost studies and 3 were cost effectiveness studies. All compared ultra-high risk programs to the standard of care, with the exception of one that focused on improving referrals to ultra-high risk programs. The included studies examined a time period between 0.5 to 3 years, with one examining 10 years of the program's cost and effectiveness. Most looked at health system costs, while one looked at the cost to society. All cost effectiveness studies found that ultra-high risk programs were preferred over the standard of care, with one cost study finding these programs were cost saving. Our risk of bias also found moderate levels of bias. So after reviewing all of these results, we determined that caution must be exercised when examining our findings. This is because there are many limitations to the included studies in their methodology. So first, few used quality adjusted life years as their outcome measure. So quality adjusted life years are the gold standard in terms of economic evaluations because they provide a measure of the quality and quantity of good life years. Second, few studies examine the societal costs of the program and/or longer time periods. And finally, ultra-high risk programs and the standard of care are actually not standardized across countries and contexts. So we can't really comment on which intervention is best within the umbrella of ultra-high risk programs. There were also limitations to our review. So no meta-analysis could be conducted because of the earlier listed limitations. And we could only examine English studies. So there may be publication bias where any negative studies could be published in non-English journals, which could not be captured in our review. So in conclusion, future studies should look to making one, more economic evaluations on this population, as well as examining societal costs and also providing better outcome valuation for their studies. So that concludes my presentation. I would like to thank my co-supervisors, Dr. Lee and Dr. Anderson, my advisor, Dr. Palaniappan, and my colleague Tammy Lau for contributing to this study. And I'd also like to briefly acknowledge my funding sources, including the Western Graduate Student Scholarship, as well as a CIHR grant.